The nuclear transcription factor PIT1 is also called as POU1F1, POU1F2, POU1F3, and POU1F4. So the correct answer here is POU1F1. Why? This POU1F1 stands for POU domain. It is a class 1 home box 1 gene. PIT1 is a pituitary lineage determining factor. PIT1 is also known as POU1F1 is a nuclear transcription factor that plays a crucial role in development and function of pituitary gland. Some key points about PIT1 are: number 1, gene regulation. PIT1 is involved in regulation of several genes crucial for pituitary development and hormone production, including those for growth hormone GH, prolactin PRL, thyroid stimulating hormone TSH. Pituitary development. PIT1 is essential for differentiation and proliferation of specific cell types in the anterior pituitary gland, such as somatotropes, lactotropes, and thyrotropes. Now, the genetic mutation and disorders. Combined pituitary hormone deficiency, also called CPHD. Mutations in PIT1 gene can lead to combined pituitary hormone deficiency, CPHD, characterized by deficiency in multiple pituitary hormones, including growth hormone, PRL, and TSH, as shown in the figure. Growth hormone deficiency. A lack of functional PIT1 can result in isolated growth hormone deficiency affecting growth and development in children. The mechanism: transcriptional activation. PIT1 binds to specific DNA sequences in the promoter region of target gene to activate their transcription. POU domain. PIT1 belongs to POU family of transcription factors. So the correct option here is POU1F1. Now let us move to the next question. Peak ACTH secretion is seen at A 4 a.m., B 6 a.m., C 8 a.m., and D 10 a.m. Now this ACTH secretion is pulsatile with circadian rhythm, peaking at 6 a.m. and reaching a nadir around midnight. Adrenocorticotropic hormone is secreted by anterior pituitary gland and plays a key role in regulating cortisol level from the adrenal cortex. The secretion of ACTH follows a diurnal or circadian rhythm with distinct peak and trough periods. Peak ACTH secretion. ACTH secretion typically peaks in the early morning hours between 6 a.m. to 8 a.m. This peak coincides with highest level of cortisol, which is a part of body's natural circadian rhythm. Influence. The peak in ACTH secretion is influenced by hypothalamic pituitary adrenal axis and is driven by circadian release of corticotropin releasing hormone from the hypothalamus. Now, the factors which influence ACTH secretion are stress. Physical or emotional stress can lead to increased ACTH secretion regardless of the time of day. Sleep wake cycle. Disruption in the sleep wake cycle, such as shift work or jet lag, can affect the timing and amplitude of ACTH secretion. Light exposure. Exposure to light, particularly in the early morning, can influence the circadian rhythm and impact the ACTH level. Clinical implications: Cushing syndrome. Elevated levels of ACTH, particularly outside the normal peak times, can indicate conditions such as Cushing syndrome, where there is excessive cortisol production. Addison's disease. Low level of ACTH may be seen in primary adrenal insufficiency, that is Addison's disease, where the adrenal gland do not produce sufficient cortisol. Now, diagnosis and monitoring. Understanding the diurnal rhythm of ACTH is important for accurately diagnosing and monitoring adrenal and pituitary disorders. Blood samples for measuring ACTH are often taken in the early morning to capture the peak level. So the correct option here is 6 a.m. Now let us move to the next question. Bardet-Biedl syndrome is characterized by A. Mental retardation, B. Renal abnormalities, C. Obesity, D. All of the above. From the figure you can see in Bardet-Biedl syndrome there is learning disabilities, visual impairment, that is rod cone dystrophy, obesity, kidney problems, genital and hormonal problems, that is hypogonadism, extra toes or fingers, polydactyly. So the correct option here is D, all of the above. You can directly WhatsApp me on this number 948 365 2020 regarding any queries. You can also join my masterclass 3-day Neet PG Breakthrough Blueprint Masterclass by clicking the link in the description box. So let us move on to the next question. Which of the following gene is associated with Prader-Willi syndrome? A. GnRH1, B. PROK2, C. CH7, D. SNRPN. The correct option here is SNRPN. Now, what is Prader-Willi syndrome? In Prader-Willi syndrome, there is a deletion or uniparental disomy in chromosome 15. The gene involved is SNRPN, that is small nuclear ribonuclear nucleoprotein polypeptide N. The position is 15q11.2. Prader-Willi syndrome is a complex genetic syndrome characterized by variety of physical, behavioral, or cognitive abnormalities. It results from loss of function of specific genes on chromosome 15, typically involving a paternal deletion or maternal uniparental disomy. Both copies of chromosome 15 inherited from the mother. Key features: hypotonia. Newborn with Prader-Willi syndrome often have poor muscle tone, leading to difficulties in feeding and delayed motor development. Impact: this can result in poor sucking reflex and failure to thrive in infancy. Hyperphagia and obesity. Children with Prader-Willi syndrome develop an insatiable appetite, leading to chronic overeating, that is hyperphagia, and severe obesity if food intake is not controlled. Onset typically starts between ages 1 and 6. Growth hormone syndrome. Many individuals with Prader-Willi syndrome have low levels of growth hormone, leading to short stature and reduced muscle mass. So the correct option here is D, SNRPN. Lymphocytic hypophysitis mainly occurs in A. Unmarried female, B. Postpartum female, C. Short-statured female, D. Infertile female. It is postpartum female. Gene associated with Unrich Lundborg disease is A. CSTB, B. DEPDC5, C. EPM2A, D. LGI1. It is the correct answer here is CSTB gene. Which of the following statement about Lennox-Gastaut syndrome is true? A. Multiple seizure types. B. EEG shows slow spike and wave discharges, impaired cognitive function. Correct option here is D. All of the above. Characteristic of Landau-Kleffner syndrome include A. Auditory agnosia or word deafness, B. Normal hearing, abnormal electrical brain activity, D. All of the above. Gun barrel vision is best related to Anton's syndrome. CADASIL is due to mutation in which gene? This CADASIL means cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. Is an inherited disorder caused by mutation in a gene called as Notch3, the most common genetic cause of stroke and vascular dementia in adults. It is Notch3. Pentobarb coma refers to high dose of barbiturate for refractory elevated ICP. Polycystic lipomembranous osteodysplasia with sclerosing encephalopathy is also called as Nasu-Hakola disease. Which of the following procedure is used for correction of TGA? Mustard procedure, Rasteli procedure, Senning procedure. This is corrected by all the three: Mustard, Senning, and Rasteli procedure. All of the above. Tarenfluorbyl and semaglutide are the gamma secretase inhibitors. Dementia pugilistica is related to which of the following? It is recurrent head trauma in professional boxers. Familial Parkinson disease is associated with mutation in which of the following gene? A. PINK1, DJ1, Parkin, all of the above. It is all of the above. Which of the following about Kufer-Rakeb syndrome is false? The only oral agent that reduces dyskinesia while improving Parkinsonian feature is amantadine. Swollen axons of Purkinje cells you can see in the image. A. Missiles. B. Torpedo. C. Gun barrels. D. Cannons. It is torpedoes. Here you can see clearly the torpedoes in the figure. This is the AT is the axonal torpedo. Which of the following is gene for isolated dystonia? TOR1A, THAP1, ANO3. It is D, all of them.